Dr. Clifton Bingham, Director of the Johns Hopkins Arthritis Center. Thank you for visiting the Arthritis Center website. In the next few minutes, I wanted to provide you with an update of the exciting developments taking place in the last year in our center. The Arthritis Center is the largest and one of the oldest specialty centers in the Johns Hopkins Division of Rheumatology. Our division is oriented around the singular idea that patients hold the answers to understanding rheumatic diseases and autoimmune conditions. As such, we use a three-pronged approach to the patient focused on providing outstanding clinical care, conducting research focused on understanding disease and improving outcomes that matter to patients, and in developing educational material that helps patients, their families, and healthcare providers better understand their diseases so that they can make more informed health decisions. The Arthritis Center was founded in 1999 to focus on various forms of arthritis, primarily inflammatory types. We've grown to 8 clinical faculty, 2 laboratory researchers, behavioral and social scientists, 2 nurses, 7 research staff, and 2 administrative support personnel, as well as visiting postdoctoral fellows from the United States and abroad. In the last year, we've seen more than 4,500 patients in our center. On the patient care front, we've expanded and reorganized our clinical space to allow us to incorporate our entire arthritis outpatient services in a single location on the Johns Hopkins Bayview campus, and to move our general rheumatology clinics to the same location. For those of you who receive our care in our center, we appreciate your persistence with us through these changes and hope that you find the center more accommodating and efficient. The implementation of the Epic electronic medical record system has also been a considerable change in how we provide care and conduct our research. Our clinics were in the early phases of adoption of this transformative system, which is now fully operational across the entire Johns Hopkins health system. Our physicians, researchers, and clinical staff hold regular meetings to seek ways that we can make this system even more efficient in expediting your care and improving communication. In the coming year, we'll be working on several initiatives to further improve the patient experience. These will include the development of videos and stories about our faculty, staff, and our research initiatives that will be shown in the waiting room, as well as using the Epic MyChart system to provide individualized educational materials and links to web-based learning. Additional efforts to further integrate the Epic system with our research operation will also be underway. We've had a very successful year in terms of our research initiatives. Our research team includes all of our physicians, as well as laboratory-based scientists, health services researchers, and 6 research coordinators. From 2014 to 15, Johns Hopkins Arthritis Center researchers published more than 70 research articles in major national and international journals. These included a study showing that yoga can be safe and effective in improving symptoms for patients with RA and osteoarthritis, a study that showed the range of symptoms experienced by patients with rheumatoid arthritis, and a study based on focus groups with RA patients about how they experience stiffness and talk about it, as well as clinical trials of new therapies. Our lab researchers have described new autoantibodies in the blood of patients with rheumatoid arthritis that may identify a group of people that have a higher risk of developing lung disease. Our faculty have shared these findings in presentations at regional, national, and international meetings. New research projects have also been started for patient-reported outcomes in rheumatoid arthritis and psoriatic arthritis, clinical trials for RA and psoriatic arthritis, including stem cell therapies as a new approach, and an even more comprehensive research database across our different diseases. In the last year, we've received new grants from the Patient-Centered Outcome Research Institute, or PCORI, the National Institutes of Health, the Rheumatology Research Foundation, the iRefine Discovery Fund, and the Stabler Family Foundation. We've started a major effort to tell the story of research in ways that are meaningful for patients, their families, and other doctors. These include printed materials, web-based materials, videos, and even podcasts. You can look forward to seeing more of these in the next year. We're deeply committed to the education of our patients, their families, and healthcare providers concerning arthritis, treatment options, and lifestyle considerations. We have developed new content for our website. More than 1 million unique visitors come to our website each year for health information. Some of the highlights include content regarding rheumatoid arthritis and psoriatic arthritis, medications and potential side effects, videos showing how to give injections, instructions on exercise, and many more. To understand what people coming to our website really care about, we conducted a survey of our visitors. Based on the results of this survey, we're developing new content to address the specific needs that you said were important. These are only some of the highlights from our center in the last year. In the next year, we're committed to more effectively sharing our stories concerning research, education, and patient care through the web and newsletters. We hope to better engage you, people living with arthritis, or those caring for people with arthritis, health providers, and others, to help us develop resources that will better meet your needs. Many of the projects and initiatives that I described to you earlier were made possible through the generous support of our grateful patients and other donors. Our research and education funds help support young investigators and trainees to launch their careers, to fund pilot projects and gather critical preliminary data, and help our established researchers go into new and innovative areas. They also help us to create content for the website. We hope that you may consider supporting our work. We thank you for visiting our website and look forward to seeing you again. Thank you.